can you put it in the chat directly to me, not to everybody, because otherwise all the world will be able to see it. So can I welcome you to the Children and Young People Scrutiny Committee for December. I'd like to welcome Councillor Abid Chauhan to his first meeting. Good to have you on the committee, Abid. I've got apologies from Councillor Amna Abdul Latif. Have you got any other apologies, Rachel?
Oh, no other apologies received.
Okay, thank you. Okay, right. Is there any urgent business?
None, Chair.
Okay. Any appeals?
None, Chair.
Any interest that members wish to declare? No. Okay. Minutes of the last meeting, are they approved as a correct record?
Approved.
Yes, approved.
Thank you very much. Let's get
Approved.
Okay, they have been through council actually last week, but we do need to approve them. Okay, if we move on then to item 1, which is the presentation on early years. We've got 2 presentations today. We've had them for a week. They came out last week. So I'm going to ask the presenting officers just to highlight things in the presentations, not go through them page by page, and that gives us more time then to ask questions. So basically, I think you all know I like to brief introductions to things to give us as much time as possible to debate. So who's presenting the early years, please? Is that Julie? Julie Heslop?
Sorry, Bernard. Yes, it's myself, Bernard Along. I've got 2 colleagues joining me this morning. I've got Tracy Forster from Health Visiting and Nazreen King, Strategic Lead for Early Years. So I will start off, as you said, we will not go through every slide, but what we aim to do is this presentation gives scrutiny members, it's an update on our priorities and our deliveries from the early years and partners during the COVID coronavirus pandemic. We will focus on our priorities and our engagement over the last few months. We'll talk to you about our delivery and our response. We'll share with you some of our challenges and how we've responded to these, and we'll also talk to you about our future priorities. I think it's important to say that obviously during the coronavirus pandemic, the importance of prevention and effective offer from early help is clearly being demonstrated, and together with numerous research and evidence reports over the last 6 to 8 months, has certainly consolidated by our experience in Manchester, has shown the importance of families having access to good advice, support and essential support if they are going to mitigate the disproportionate impact of coronavirus. Next slide, please. So I've just covered our overview and introduction, so if you go to the next slide. So just a quick reminder of some of our strategic priorities in terms of our early years service and our partnership. Our Start Well priority continues to be our key priority for the city, connects well with our offer from our early years within the first 1,000 days. We've continued to meet as a Start Well partnership throughout the pandemic, and that's enabled us to take a focused and collaborative approach, particularly in response to certain issues. So you'll hear today how we're prioritising the work to make sure our babies thrive. We've connected well to make sure that our perinatal mental health pathway, particularly responding to social isolation, continues to be at the forefront of our work. And we've also prioritised other areas of public health, including dental hygiene, as well as ensuring we continue to have a broad offer. Throughout the last few months, is in line with our Start Well priorities, we've undertaken some engagement and consultation with our residents and communities, and we want to share with you a little bit of the headline feedback from that, but also to demonstrate that it is possible still to continue to do that collaboration. Our focus is on babies in 0 to 2 years to ensure they are thriving, and we continue to make sure that all our work, including our parenting pathways, communication, speech and language and core offer, ultimately helps improve school readiness for our children and families. Finally, I'd just like to say, obviously, another priority we're focusing on is our locality programme, and that gives us the opportunity to continue to develop and strengthen our partnership work. And you'll hear today about some of the thematic projects that we're doing to strengthen some of that joint working. Next slide. So as I said earlier, we've commenced a Start Well strategy. We have a Start Well strategy for Greater Manchester, but we recognised that within the City of Manchester, we really wanted to do something that demonstrated the city and the partnership commitment, particularly to the first 1,000 days of a child's life. So what we've been doing, and some of it was initially delayed back in April, May, but actually in the last few months, we've undertaken a significant piece of engagement and consultation, and that's taken a number of different forms. We did a survey for staff and volunteers, so what was their experience and what would they prioritise in terms of the early years, and then we've undertaken a significant number of conversations with our families, and what we wanted to do was to have quality conversations, and we've been really creative in our approach. So we've had conversations with families in parks, in children's centre gardens, in lots of different venues throughout the city, and as you'll see in the next slide, that's highlighting some of the themes and issues that are emerging. Next slide, please. So in terms of our conversations, we've had around 188, and this was obviously what we wanted to do, was make sure that they were quality. But those conversations have focused on asking families, residents, children, parents, a number of broad questions which focused predominantly on what are their priorities and aims and aspirations for their children, and secondly, help us understand what's been the impact of the corona pandemic virus for you and your family. And you'll see we've had a really good partnership, particularly want to mention the partnership we've got with the Buzz Health and Wellbeing Service. They have helped us have a really creative response, and as I say, we've had conversations with parents on buggy walks and treasure hunts. We used the opportunity through the half-term school holiday to see families out and about in our community. We've really tried to take an inclusive response. We've had some brilliant feedback from Manchester Parent Champions and Carer Forum. We've had some good conversations from our refugee and asylum seeking families, and we've got a much better understanding about some of the challenges. So our next steps are we're just in the process of collating that analysis and the information and the themes. That will come together in January, and then we will use that to inform and shape what will be a Start Well strategy, and I will be able to bring that strategy back to you. We anticipate it will be ready for around February of next year, which will highlight the key priorities, but also our action plan linked to Start Well. Next slide, please.
For a second, I've just had a message from Miss Barnwell to say that she's a member of the Manchester Parents Forum. So can we report that as an interest, please? Okay, that was it.
Thank you. Obviously, we want to share with you what's been the impact of the coronavirus pandemic, particularly in our early years. And you'll see on this slide, we've highlighted some of the issues. So one of the key things has been our reach, and particularly in the first part from March to June, what we saw was a drop in that reach. And that very much reflected some of the issues around having face-to-face contact with families. And we'll talk to you what we're doing to address that. The cancellation of the early years foundation stage assessment obviously means for our current baseline data isn't available, but despite that, what we have undertaken is a very targeted approach to make sure that our children had home learning packs, and throughout the summer had a particular focus on the 2-year-olds. We know there are some uncertainties around the impact, and some of this will maybe be delayed. And we also know there is the potential of the widening attainment gap. We recognise our families are experiencing significant hardship, and throughout our delivery, what we've kept very firmly a focus on making sure our services are accessible, that we continue to have reach. We've looked at our offer through our digital offer, and whilst that's accessible for many families, what we've continued to do is to make sure our Sure Start Children's Centres are open, and we've seen an increase in families who've self-referred and continue to access those services. We will have an evaluation of the impact of our early years delivery model, which is our partnership model over the last 4 or 5 years, and we should have that available for the spring. Next slide, please. You've previously had reports from my colleagues which have given an update on the impact on the early years private, voluntary and independent sector, and this slide just highlights some of the work that we've been doing to support this sector, because we recognise there is a fragility there without the support, and we continue to provide support both in terms of visits, quality assurance and having the support from the wider quality assurance early years team. Next slide, please. We know currently that we're looking at and considering a number of budget proposals. That clearly reflects the situation that the council is in, with the projected £105 million budget gap. There are a number of those proposals that also relate to our early years service, and we've highlighted a couple of them there. We have a locality delivery model, which is a service redesign, which we were already going to implement anyway, and that will connect us into a locality delivery model, and that will move us from our current arrangements into the 30 locality structures, and we anticipate that will be live from April next year, and linked to that, that will leave some efficiencies. And then we've got a number of proposals linked to our parenting and our speech and language offer, both of whom we are currently completing impact assessments, and we're working closely with our partners to look at what a redesigned and revised offer will be.
Okay, can I just interrupt you a second there, Julie? Just to emphasise that these are the proposals we looked at the last meeting, and they are at this moment officer proposals. Our minutes did go to the executive at the last meeting and they were noted, but at this moment in time these are not political proposals, they are officer proposals, and at the next meeting in January when we'll be looking at the budget in detail. So I just want to emphasise that these at the moment are only proposals from officers. Thank you.
Thank you, Councillor Spone. Yes, that's correct. They are just proposals at this point in time. Next slide, please. Okay, I'm going to move on to Nasreen, who will just talk to you very briefly and give you a flavour of some of the services and adaptability from the Sure Start Children's Centres with partners over the last 7 months.
Okay, thank you, Julie. Hi, I'll just kind of highlight the main issues really. So I think what is important to note is that throughout the pandemic, Sure Start Children's Centres have remained open. We did, in the early days, in March, there were some services that were paused in terms of we had to kind of work with our partners to understand how we would develop new ways of working under the restrictions and how we could still continue to deliver an offer to families and children across the city. One of the things that we were really keen on as a service was that we wanted to ensure that families still had access to essential health care, and that we were able to support families that were had issues around family poverty or financial hardship. In particular, we knew that the pandemic would have a disproportionate impact on some families that were already on low incomes, and potentially were then going on to a situation where they're on furlough, which reduced their income either further, or in some cases a lot of families lost their employment. That resulted in a number of, we worked very closely with our midwifery colleagues, and we ensured that we had local, accessible and good antenatal care available across the city. And Sure Start Children's Centres facilitated food banks and food clubs, and also early years outreach workers were available for family support, information, advice and guidance. We worked with a number of partners in looking looking at, you know, what services we could deliver, and we adapted our service delivery. We created a lot of resources online, opportunities for families to come together in terms of coffee mornings, play, stay and learn sessions, cooking projects. We utilised outdoor spaces, green spaces, parks. We had community gardening projects where we supported families to grow their own veg and plants, and activities for the children to do at home. And we also accessed grants and worked with our voluntary sector and partners and received donations to support vulnerable families with some essential household items, basic needs such as clothes, shopping vouchers and toys for children. Next slide, please. Again, I think this is just really highlighting the significance of the outreach worker role. They've really played a significant part in supporting families throughout the pandemic and continue to do so. They've maintained contact with all families and have been available for agencies and families to self-refer. There's a range of support that the outreach worker role has provided to families around benefits. They've been quite active in delivering food parcel, activity resources for families to undertake activities with the children at home. They've accessed essential equipment for families in terms of cots, blankets, beds, formula milk. They've dealt with housing issues and overall really been available to support the overall mental health and wellbeing of families by providing that one-to-one support and access to therapeutic services. And I suppose what we wanted to demonstrate here was the significant demand for these services. From March to September, we've supported over 10,000 women through our midwifery and antenatal services, and supported over 5,000 families to access food clubs, and over 26,000 families around information, advice and guidance and family support. Next slide, please. Okay, again, this is just some parental feedback really, in terms of, and you can see from the feedback how appreciative, families have been just to have an outreach worker, contact them to support them with some of, the activities that they've done with children. But also, I think it just speaks volumes in terms of how appreciative families have been of the contact and support that's been provided to them throughout the pandemic. Next slide, please. Okay, so this again is our speech and language service. We have a communication and language pathway which supports our early years offer. It's a community-wide strategy. We've trained over 3,000 practitioners across settings, Sure Start children's centres, health visiting teams and schools. Again, as a result of the pandemic, we had to pause and think about our intervention and our approach, and how we could and look at ways of how we could continue to support children and families. And as a result of that, the speech and language team developed an approach which was a guided conversation based on the ICANN resource. We trained all of the community nursery nurses who were part of the health visiting team and the early years outreach workers in this approach, so that we could continue to offer support to families and assess the needs effectively, assess the communication and language needs of children remotely. So we're currently offering a blended offer of support, which involves face-to-face contact with families. Contact over the telephone and virtual support continues to be offered. Of all the children that were screened during this period, 63% of children showed a delay in their language. So we completed 612 language screens, of which 247 children scored red and referred to specialist services. 138 children entered into intervention, and 227 children were signposted to universal services. The review data shows you, I'm sorry, I can't see the full slide, just bear with me. Okay, so 3 months post-intervention, all children are reviewed to understand the sustained impact, and what that data has shown us is that 3 months post-intervention, 42% of children were referred to specialist services, 48% of children were at typical levels of language development, and 10% of children required an ongoing intervention of some sort. What that means for school readiness is that when children enter into school, they will be at typical levels of language development or enter into school with a full package of support addressing their communication and language needs. Next slide, please. Okay, so this again, as part of the early years offer, we have a parenting pathway which is delivered by our commission service provider, CAPS, our Children and Parents Service. I think the main things that I want to highlight here is the increase in referrals during this period of lockdown between March and September in babies. For the same period last year, we had 61 referrals. This year, we've seen a peak of up to 127 referrals for babies. The families that are presenting with higher risk factors. These are new parents who have just had babies, experiencing isolation, low mood, anxiety, mainly due to not having access to wider family support or potentially the usual services that they would have had access to pre-pandemic. So from September, a full programme of delivery, including virtual groups and face-to-face groups, continue to be provided for families. So in terms of the data, we've had 378 children that have entered into this intervention, and if you look at the data there, it's generated over 3,000 contacts. So the teams have worked really hard with these families, and as you can see, a significant level of contacts and face-to-face work has taken place. So as part of this pathway, clinical psychologists lead the intervention and undertake assessments that measure whether parents are in the clinical ranges for attachment and bonding, depression and anxiety, and child conduct behaviour problems. So from the data, you can see that 69% of parents move from clinical to non-clinical ranges for maternal warmth, so that's around attachment and bonding. 72% of parents move from clinical to non-clinical ranges around clinical depression, and 76% of parents move from clinical to non-clinical ranges on the standardised measure of anxiety, and 136 children move from clinical to non-clinical ranges on the measure of child conduct behaviour problems. Next slide, please. Okay, supporting school readiness. So this again is...
Julie, can we assume that people can read the figures in the report, because you know, they're there, we've got it in sense, because we've also got it on screen. So for the rest of the report, I'm conscious that, you know, for time, that we just highlight.
Okay.
Yeah.
Okay. All right. That's fine. So just coming to the end of my kind of bit now, we just want to talk about you know, the targeted focus that we had on our eligible 2-year-olds that are eligible for their free entitlement. We wanted to ensure that children that were vulnerable still had access to quality learning and development opportunities. So we did run a project over the summer where outreach workers targeted all of our eligible 2s, and we supported over 1,000 families with an activity pack, and we included the resources that promoted key learning skills and communication, language and literacy, because we know from our analysis of school data that these are the areas that children need additional support with. And at the end of the project, we did an evaluation which showed improvement in these areas, and we had some real positive parental feedback. Next slide, please. And again, this is just the parental feedback, so members can read the positive comments that were made by parents. Next slide, please. Thank you. I'm going to hand over to my colleague from the Health Visiting Service, Tracy Forster, that can talk you through the next few slides. Thank you.
Good morning, everybody. I'd just like to also say that I've got Lisa Sanchez with me this morning. Lisa's one of the 3 heads of health visiting service across across the city, and she's with me to answer any questions. So just to take you through the 3 slides relating to the health visiting service response during the corona pandemic. Just to say really the main message is that the health visiting service did remain open and accessible to Manchester families throughout the response. And that wasn't always in line with how other health visiting services across the country were asked to deliver. Some in other areas, health visitors were redeployed and the services was a very minimal service. In Manchester, we maintained a full service delivery, which was really good. In saying that, our health visitors and our community nursery nurses and staff nurses did receive basic updated nursing skills to enable them to be ready for redeployment if that was to happen into direct nursing care. However, there was strong representation from our lead nurse and from the LCO and the recognition that the need of the health visiting service to be continually out there working in the community was felt to be very important. And at the end, we only had just about 2 health visitors were redeployed for a period of about 3 months. So we were very lucky, and I think that recognises the needs in Manchester. During this period, we were also able to continue to develop the universal offer of the Healthy Child programme. There was guidance received from the Department of Health that health visiting would be a partial stop service, but as we didn't lose staff, we were able to continue to deliver. We did have to change the service delivery. We had to reduce, stop all our non-essential home visits, our Saturday working, our groups, and all our Healthy Child Well Baby clinics were suspended. We had PPE available to support the face-to-face visits, but face-to-face visits did have to reduce and were replaced by telephone contacts. And there was a large reduction of a 60% reduction in face-to-face visits in that first 3-month period. We increased the duty phone lines in the 20 teams across the city to enable our families to be able to easily contact health visiting, and those lines were extremely busy. Much the same way NAS has suggested in the children's centres, we were receiving queries about a whole range of issues that were important to families, and we were able to signpost and offer advice and provide information. We'd been working as a service towards delivering a mobile offer, and all our health visitors had iPads and laptops, and so were easily able to work from home when that was necessary due to the social distancing in the offices and the pressure on the estates. And during the first phase, some of our health centres did need to close for various reasons. We included messages on the COVID-19 health education to help our families understand the media messages and to give it in a language that was understandable to them. We called that initiative Flattening the Curve, and we included that into all our contacts, and that was very well received. From June onwards, we had a guidance from the Department of Health to resume a full service delivery, and for that in Manchester that was more around increasing our numbers of face-to-face contacts, and we increased the number of appointment-only clinics across the city, and where we had estate issues in our own buildings we were able to take advantage of additional space that was released for us in the children's centres, and that was very gratefully received. We reintroduced our Saturday working from September, and during the current lockdown, there's been no change to the delivery in the health visiting service. Can I have the next slide, please? So the next slide talks about the performance of the health visiting service during this period. Q4 and Q1 are presented here for your information. Due to our reporting timescales, I've not included Q2 because that's not been formally presented to our commissioners. However, I can advise that the draft position is an increase in our new birth visits seen under 14 days, up to 87%, which is looking very good. And the maternal mental health in the 6 to 8 weeks, largely the same, or they are the same as quarter 4 and quarter 1. And the 9-month and the 2-year developments, there has been a bit of a reduction. You can see the reduction there in quarter 1. That started to increase in quarter 2, but there's a bit of a reduction in the 2-year-olds. So largely, you can see from these performance figures the proof that the health visiting service was able to continue its service delivery, which was welcomed. And you can also see in the general activity at the bottom of that slide that the swing from face-to-face to telephone contacts, and now in quarter 2, that's beginning to go the other way. So it's about a 40-60 split in quarter 2. So about 40% of face-to-face visits as opposed to 60% on the telephone. Can I have the next slide, please?
Just to highlight anything on this slide, I'm conscious that we've been going half an hour now on this report. If there's anything you want to highlight on the next?
I can leave it as that and take questions. Or perhaps just would like to highlight one thing, just to say that the messaging, the chat health service that is referred to in the second to the last bullet point, actually started on Monday. So we're very pleased we've got that initiative, because whilst our healthy child drop-in clinics remain closed, the chat health text line will be a really useful way for families to maintain contact or contact the service when they need to, and we can immediately get back to them during the working day. And I think that would be a really helpful way of increasing the service's reach. Julie, do you want to do the next slide?
If we can move on, I am conscious of time, so Councillor Stone, I would just, obviously for scrutiny members to note, the next 2 slides sets out the priorities going forward for us as a partnership, the continued work we will do to adapt and maintain a strong offer for our families, and also highlights the collaboration and some of the thematic work that we're doing with our focus on thriving babies, our work around smoke-free families, and our Think Family approach. And finally, our last slide just provides a summary of the support and the work and the issues that we've identified over the last 6 months. And I will leave it there, and obviously we will answer any questions from scrutiny members. Thank you.
Okay, thanks Julie, Nazreen and Tracy for the introduction. Right, I've got Councillor Lovesey. Could we go to...
Thanks. Can you see me?
Can now.
Thank you very much. Thank you, Chair, then. Well, first of all, really huge thanks to you for providing so much detail at this stage, which is really, really useful to us as a committee. This is such a crucially important area of provision for our city, and it is really heartening to see how you've been able to be really creative and adapt your services to this very challenging period for our families and their children. So really want to underline that at the outset. And obviously some of the evidence you are providing here is particularly heartening in terms of the evidence you can provide us for impact of and outcomes in relationship to things like speech and language, which is such a core aspect of what we must tackle to support our children, the outreach workers in early years and our health visitors. I've just got a couple of questions to perhaps give a little bit more understanding of where we're at. One question is page 21. You note that 120 settings remained open for our early years private, voluntary and independent sector. Could you just tell us how many that's out of, so that we've got some sense of the relativities, because I think probably most of us are aware of provision that has actually folded in the course of the last 9 months. Then on page 26, in relation to speech and language, note at the bottom of the page that after 3 months, so it's quite a significant proportion of the children, 42%, needed to be referred to specialists for further support. And could you just give us some idea about our capacity for specialist support? Because that sounds like a higher rate than perhaps we would normally be moving on to that kind of provision. So if we could just have a bit more detail on that. And then now, this is a sort of, I think it's a significant point. On page 18, oh, hang on, page 18. Sorry, let's skip forward to the end. There's a point you make right at the end. No, I'm not finding it, but there's a point you make about budget. But where we're putting outcomes for families second after budgetary pressures. I'll find the page and note it in the chat. But I think it is really our purpose as a committee, however much we get taken up with budgetary issues, is in terms of outcomes and our ambition to improve things. And I think whenever we're writing reports, we need to put those outcomes as main focus.
And Jill, is that page 22, which talks about the budget?
I think so, yes.
Yeah, as I said earlier, they're only proposals at the moment anyway.
But yes, it just sometimes it seems like a shorthand, but really our focus is on the children and the families and on the outcomes and not on saving money. Yeah, thanks.
Okay, yeah, no, that's why I made the emphasis earlier in the presentation about the budget, that at the moment needs to stop us with proposals and they're not going to agree or anything like that. Councillor Reid.
Hi, good morning. That's a brilliant report. Early help's come a long way from its origins. Sorry, as a fledgling, with got to mention Councillor Sheila Newman about seeing the vision, and it has become more through Julie and team than we ever expected it to be. And during the pandemic, it's been absolutely invaluable, I've got to say. I've seen that firsthand with helping people with food offer, and meet people at the door and saying, are you getting early help? So it's something I always say now to young families, are you getting the help? And invariably the answer
early help's the next report.
Oh yeah, I'm just saying what it's included in this. Yeah, it's included. It's people who are not in school. So I'm talking about preschool. Now children are back in school, they're getting the help they need in school, but quite often in early years, they're not getting the help. And they've been locked down and isolated. So I do realise that there's going to be an awful lot of things that people need. The second thing was around people's fear. I know from my own daughter-in-law, my grandson would be in a nursery, was it not for COVID? There's a fear really of putting them in nursery for the first time. Had they previously been in a nursery? And I know that numbers are down, quite a few PVIs. So you've met there, but I do know PVIs struggling to survive, and some have actually gone under. So I just wondered if you could comment on that. Really, I think it's quite sad, and I think once this is over, I think things will start to get back to normal. I just hope, like the shops and stores and hospitality in COVID, that people will be able to come back, and we don't lose too many things because of financial issues, because of the numbers of children that are going into services. The second thing was about the financial thing. Just to reiterate what Councillor Stone and Councillor Lovesey have said, is that they were officer proposals, and therefore they should not be taken as that those decisions have been made, because they haven't. So until we actually get the government final settlement, we will not know what's happening. And certainly, as you know, I'm vehemently against any kind of cuts to children's area anyway. So that, you know, we need to make sure that that isn't taken as read, because it isn't. And then other things I wanted to mention was about things like separation anxiety, talk about attachment and bonding, that when children leave, there's definitely with children a fear. And I think it's because all around them, they're hearing people talking about COVID 24/7, the news, people are just discussing it all the time. And I just think they're getting scared. You know, none of us have lived through this before, and we're adults and we're finding it difficult. So I think that we have to acknowledge the fact that it's very difficult for young children to cope in these difficult times. And then finally, to look at the surveys that you've done, and you know, I can see all the positive comments, etc. But about the reach, about where, you know, the areas, is there any areas of reach that you've not, you know, you think that we didn't get into that area or didn't get much back? And you said something about being able to, health visitors being on the phone to people. I just wondered whether that was also a visual Zoom in, you know, or a Google Meet or whatever, being able to see into people's houses at a difficult time when you cannot contact them and they're not in the school system, and maybe there are things going on that you don't know about. So it's particularly in the second lockdown as well, about that. That'll do for now. Thank you, Chair.
There is a mention I'd actually picked up as well about the digital offer on page 20, so if we could perhaps expand on that. But who's next? Councillor Hewitson.
Hi, thank you. Thank you for your report. It is an excellent report. Both Councillor Reid and Councillor Lovesley and have asked the questions I was going to ask. I think I've only got one to ask. How many BAME families have you been in contact with regarding the speech and language? And I forgot what the other question is now. And the question's gone out of my head. It's just disappeared out of my head, sorry. But the thing with babies, I've been on Facebook there. I've got a friend whose daughter, she's just had a young child, and she was struggling at home with a young child, you know, a young baby. She had nowhere to go until I give her the advice on who to contact. And that's the thing, when a young mum comes from a hospital with a baby, and in the times now we've got coronavirus, they're struggling at home and there's no contact. It's not a face, like you say, it's not a face-to-face. It's always either on computer, and that's the difficult thing for these young mums. And you know, it's hard times. I mean, a lot of them don't want to be seen on camera, prefer to talk to somebody in person. But yeah, if you could give me an answer on the how many BAME families you've been in contact with, please.
Okay, thanks, Tina. Councillor Kilpatrick.
Thanks, Bernard. Just two very quick questions. First, thanks for the report. I think my first question is around the statistics, especially in terms of the health visiting service performance, because I think, you know, it's really commendable given the pressures on the service with COVID, just how great those statistics are. But my question is around is any possible comparable authorities, because those statistics are great, and it'd be interesting to know, you know, is that the performance of the service? Is this something that we're seeing across the country in comparable authorities? And if it is even possible at this early stage to be able to compare the visiting statistics to any comparable authority. My second question is just to ask for a little bit more information really around the specific requirements and pressures on the service, especially for first-time parents, given the very unusual circumstances, and the pressures on the ability for face-to-face visits on any. If you could give us any more information about the pressure on being able to access first-time parents.
Thank you very much. I've just got a couple of points to add myself. On page 20, the 1, 2, 3, 4th bullet point about potential widening attainment gap in relation to school readiness. I think quite a number of us are picking that up already, but if you could perhaps expand a little bit on that. And the other thing is that I was on the radio the other day, it says that the government is looking at early years, and I'm just wondering if you've heard anything about it yet, which I thought it was a bit ironic given the fact that they've cut the money for early years over the last few years. And when I was listening to on the radio, it said that only 25% of parents understand the importance of early years on the development of children. So I just wondered if you could, perhaps that's a comment rather than anything. But I mean, I thought that was quite a really frightening statistic, because I think all of us who've been through the education system or worked in education know the value of early years. It's the foundation for everything that we do, which is why it's called the foundation stage, of course. Okay, all right, Julie, please.
Sorry, some problems. In order to manage this, what I'd suggest is if I ask Nazreen to pick up the questions about, if you pick up the questions about settings and just ask a little bit about speech and language, and also if you pick up the relationship with babies and widening the gaps, Tracy will answer the health visiting questions, and I'll come in at the end with the survey and any budget. So if we can start with you, Nazreen, and the questions were Council of Lovesey in relation to settings, speech and language, and also widening of the gap. Thank you.
Okay, all right, thanks, Julie. Okay, just to answer the question around settings. So in terms of settings, we've got 130 settings across the city, and currently out of that we've got 120 settings that are currently open and operating, so that means 10 are closed. We're not seeing patterns emerging across the city in any particular areas where there appears to be a sufficiency issue. The settings that are open are quite evenly spread across north, central and south. And we do monitor on a weekly basis the uptake of children accessing provision. And my understanding is that we've currently got over 3,000 children across the city that are accessing provision. We did do an audit with settings, and we didn't have 100% response from the settings, but of the settings that we did audit, we wanted to do a comparison in terms of their uptake for this period last year, and what we found on average there was round about a 20% drop in uptake. And again, I think, you know, Councillor Reid talked about some of the issues that are impacting on that, and what we are also experiencing across early years is a lot of that is parental choice and fear of the unknown, and you know, risks potentially that parents perceive of their children accessing daycare. Shall I go on to the next question, or is there any comments on that?
No, just go through the questions, please.
So just go through. Okay. So the other question was around speech and language, and I think that was around, he wanted statistics around how many BAME families we've targeted. I can get you those statistics. I don't have them to hand, but what I did want to say was that the communication and language pathway is delivered across the city. We have children's centres in areas where we have very diverse communities, and outreach workers are undertaking welcome screens with the communities in those areas. So we do have BAME communities that take part in, that are part of that pathway. I can get you the statistics, but I don't have them to hand. The other question was around babies, in terms of what is our approach in supporting new parents. So obviously it's an area that we have picked up on nationally. They've been highlighted as a group that are isolated, and we have responded to that in terms of we've already started to offer a number of baby groups across the city. So we started offering the baby groups around about September, and we're getting really good feedback from that. We've got a number of projects that we're running with partners where we're targeting parents from quite disadvantaged areas in terms of working in partnership with Manchester Art Gallery, gifting sensory boxes. We're working in partnership with Reform Radio, where we're targeting first-time parents, and they're getting outreach support, and we're signing them up with the Imagination Library. So we are developing quite a robust offer around working with new parents, and baby groups are available across the city and facilitated from Sure Start Children's Centres. In terms of widening the gap across early years, we know that the areas where children have a gap in their learning are focused around communication, language and literacy. So our communication and language pathway are targeting those areas, and we also have an intervention called REAL, which is raising early attainment in literacy, and we are currently working with schools and outreach workers are targeting parents with that intervention. So the approach we've got with schools is we know that children that have been disproportionately impacted on by the pandemic will actually start school with poor skills in that area. So we're asking schools to identify families that we can work with and support them with the REAL intervention. And I think that's it. Thank you.
Shall I pick up on the health visiting questions? I think Councillor Reid and Councillor Hewittson's were mostly around the use of health visiting phone lines, and did we have any virtual contacts? So the majority of contacts, as we've talked about in the performance figures, were swapped to telephone contacts. But you're absolutely right, nothing beats seeing a child in person, and we did retain the ability to have appointment-only clinics where we could invite families into clinics to see them where needed, we did have PPE to go out and see families again when needed, so there was still a degree of face-to-face contacts there. We have a facility for virtual sort of Zoom type contacts over the internet, face-to-face over the virtual world. However, we're not able to use Zoom in the health settings. We have two other options that have been made available to us, but they haven't been hugely used because that we can do an awful lot with a telephone contact. And then during the initial phase, when the families were when there was very little not as much visiting, the health visitors sort of took notes and made notes about the children they wanted to go back and see. And so following June, when we were supporting more face-to-face contacts, the health visitors went back and saw those families face-to-face to see them in the home when it was safe to do so, or in the clinic. So we did sort of prioritise the children that we didn't know, the movements into Manchester, and also the new births that we hadn't met before, the first children in families, etc. So we did make those our priorities. The sort of the Zoom, with AccuRx that we use, or Attend Anywhere, those video options for visits, we actually found really useful in our infant feeding teams, strangely enough, where families were happy to have that intervention. Sometimes a health visitor will go around to observe the feed, and the actual baby was fast asleep, but actually when with the video facility, the families can contact the health visitor when the baby's due a feed, and the feed can be observed. So we actually found it very useful in those circumstances, which is quite an interesting conundrum for us. In terms of the question asked by Councillor Kilpatrick regarding performance and comparison across other health visiting areas, that comparison isn't yet available. It will be. The Healthy Child Programme data is reported centrally, but there's always a delay in that sort of being aggregated and being available in the public domain, but it will be eventually. Q4 data was late in its submission, but that should be available, but Q1 hasn't yet sort of come, so it's a bit further down the line when we get that comparison with other areas. And the pressures on first-time parents and how we get our eyes on those that I think the chair asked. Again, we have prioritised, certainly since June, we have prioritised seeing those first-time mothers and those movements into Manchester. We don't have that ongoing relationship with the families. I just want to ask, Lisa, do you want to add anything?
Yes.
Lisa?
The one thing that I'd just like to mention is about separation and anxiety, attachment and bonding. We use a perinatal mental health specialist service, which is we've created in health visiting, where we use an assessment tool, and it's called a newborn assessment, where a parent can be observed having interaction with their own child. This has been very, very effective, because a lot of parents first time think that babies don't particularly like them as parents, and actually we can give them cues, give them ideas of how to respond with your baby. We also have a consultation line for the mental health services from our health visitor, who can actually guide a parent through any anxieties that they actually feel that they are struggling with, especially first time parents when it's a new baby within the family. And also we assess that situation where they needed additional services, then obviously through Manchester's mental health pathway, then we're able to direct families to them.
Thank you.
Thank you very much. Yeah, is that everything?
Shall I just answer then? I think there was two other areas, Councillor Stone. There was Councillor Rees' question in relation to the surveys, and then also the comments we'd had back around the focus on outcomes. So just in relation to the surveys that we've undertaken are actually conversations. We have done surveys in terms of, we've actually got a resident survey, which is still out at the moment, which is an online survey. We've done a staff survey, which we're collating, but what we were particularly keen to do was to have the conversations, and so we've had a lot of conversations with families in our communities. What I would say is we've tried very hard to make sure that we have broad reach. We've used the mechanism of the children's centres because they're located in all of our communities, and we can do both the outreach into the community, but also we've used the opportunity through those antenatal sessions to have conversations with parents. What I would want to say is this isn't a one-off conversation because of the approach that we have through our Sure Start Children's Centres, and we have our Start Well partnership arrangements that actually working up in delivering on our priorities is something that we'll continue to do over the next year. And as we adapt and implement our priorities, there's always the opportunity for us to have conversations. So it's not a one-off, it's a continuous conversation. And I suppose just to share with you what some of the headlines we've had back from those conversations is everything you've said to us this morning. The family's concerns around missing one-to-one, missing peer support, missing group contact, the lack of social interaction, and hence the activity that Tracy and Lisa and Nazreen have described to you this morning in terms of how we continue to provide that diverse offer. Finally, I'd just like to say we are absolutely focused on impact and outcomes from our service. You'll see from the whole range of data that we're able to evidence the impact, and we know the work that we need to do in terms of narrowing some of that gap, and we'll be able to bring you next year that focus, which will give us actually the history and the experience of Manchester as we've implemented our early years delivery model in the last 5 years in our city. Thank you.
Okay, thank you. Can I thank everybody for the presentation? Can I just record our thanks to the health service, the health visitors, because I think they've done an absolutely amazing job and best in the country from what we can see. So could we record that? And thanks everybody for the contributions to this. I mean, I think there's some really, really good stuff going on in very, very difficult circumstances. As ever, Manchester leads the way. And just to emphasise this stuff that's been said about the budget, and that's been said 3 or 4 times, but at this moment in time, there are no firm budget proposals. But I think that given the fact that the budget is not going to be brilliant, although it might be better than we anticipated, I think there will have to be tough decisions made going forward. Okay, if we can move on to item 6, which is the early help evaluation. This is a report. I don't know who's presenting this, but I'm conscious that we spent an hour on that presentation, which I think was important to do that, but I really would like to try and get through the rest of the agenda a bit quicker. So who's presenting this? Is it Julie again?
Yes, Councillor Stern, I will start, and then I will invite Ed Haygarth to take us through the presentation, but we've noted your comments and we'll
Yeah, it's not a presentation, it's a report, don't forget. So
yes, this is a presentation attached which could
oh, right,
include
sorry, yeah,
some headlines
yeah, well,
from
just,
our evaluation.
if we could, Julie and Ed, if you could just keep it brief, that's basically.
Okay, so what we're going to talk to you today is the evaluation which covers the 5-year period from 2015 to 2020 of our early help. What was initially our analysis of the Troubled Families programme is now a broader evaluation which is on the city's offer of early help. What we'll talk to you today and share with you, which you'll see in the reports and in the presentation, is that we're able to answer the question, is the early help approach making a difference from our families? And you will see from that analysis that we're able to demonstrate that in relation to a number of different outcomes, and we're able to show some positive and sustained impact. So Ed Haygarth will just highlight to you some of the key areas, and perhaps we'll focus particularly on some of our, in terms of our attendance, our prevention and escalation to statutory services, and then finally we'll just talk to you about some of our joint priorities going forward. So Ed, if you could just do a very short overview.
Hello everybody, my name is Ed Haygarth. So yeah, Julie's just gone over briefly. I think just on the first slide, if you're able to go on to the first slide, please. There's 3 or 4 slides in the presentation that I'm going to focus on today, just to give you a bit of a flavour of the evaluation. I'm sure there'll be some follow-up questions. So if we're able to go on to the next slide, please. I just want to just focus on this one, because I think once we understand the breadth of the evaluation, I think it helps us understand the rest of the data that we're looking at. So anybody that loves data today, you've got a treat. Essentially, this first slide here, where it says number 1, I think it's really important to just recognise this, that the breadth of the offer of early help in the city is huge. We're not just talking about the practitioners that sit within the early help hub. So this here demonstrates that of the 11,000 plus early help assessments and targeted family support that has been received by the families over the last 5 years, over half of those are done by practitioners outside of the early help hubs. 54% are done by schools, health visitors, early years outreach, voluntary community sector, and loads of other people that I haven't mentioned there. And 46% are done by our internal practitioners, so those practitioners that sit within the early help hub. So I think it's just really important to recognise at the beginning, before I go through all the data, that this is a true partnership evaluation, really. It's not just an evaluation of the local authorities' offer of early help. Could we just go on to the next slide, please? Next one, please. We'll rattle through some of these. I think just the other important thing to mention there is when we're talking about assessments and we're talking about 11,000 families, it's to emphasise that we're talking about 11,000 families. That's 44,000 individuals that have received support via early help in the last 5 years. I'm not going to dwell too much upon this slide here, but just in the box there, it highlights some of the main areas where our families are experiencing difficulties. And I'm not sure it's any surprise to members, really, some of those difficulties, really. Some of the ones that are the highest there, around poor parenting, absence, worklessness, police activities, is police activity against a particular address, normally antisocial behaviour, and mental ill health as well. Could we just go on to the next slide, please? This slide comes kind of with a bit of a health warning, really, but actually when you start to understand this slide, and I'm not going to go through it now, but I will, just so members can go through it in their own time. What this tries to show is that need doesn't happen in isolation. So of the 56% of families that have a mental health problem, if you look at the penultimate line at the bottom, the penultimate row, it also shows that 62% had a family member that was unauthorised absence, or 63% had poor parenting, 76% had a safeguarding issue within that family. So what we're trying to demonstrate with this slide is that need doesn't happen in isolation. It happens, in 2s, 3s, 4s. If we go on to the next slide, please. This is an overview of all of the impact of an offer of early help. I'm just going to talk a little bit about this one before we go into more detail on the areas that Julie suggested. What the blue bar is where they're presenting needs. So it's the family that are showing that, for instance, they have one or more member that have unauthorised absence, or one or more member that had a fixed term exclusion, an adult that was on out of work benefits, or a child that was child in need, child protection. And then the orange bar shows the impact, so shows that after that intervention has been completed, 12 months after, which is the really important bit because we want to show sustained change, it then shows how many of those family members are still experiencing that difficulty. So I think you can look across all of those bars there, and we have impact across all of those areas, some more than others. And I'm sure there'll be some questions about this at the end, but what I do want to do is just focus on a few of those areas in particular. So particularly around child safeguarding, and particularly around absence and some of the impacts on education settings. So if we go on to the next slide, please. The one after that again, please. And the next one again, please. Right, it's this one I just want to spend a couple of minutes on, please. So really what this slide is trying to show us really is the impact that an offer of early help can have on statutory children's services, both in preventing children and young people from escalating, but also I think equally as importantly is helping children and families step away from that statutory support they're receiving. So if you look on the right hand side, it shows 4,337. So what that means is that of those 11,000 families that we're talking about, 4,337 had no child in need status, no child protection status, or no LAC status when they began their intervention. And 12 months after that intervention was completed, so 12 months after that early health assessment finished, if you go to the left-hand side, 4,202 families still had no status. So what this shows us really is that we know that families that are experiencing difficulties that might otherwise have escalated into children's services, 97% of those families that received early help support never came into contact with children's services. So I think that's really, really important in showing the prevention side of it. But as I said, I think equally importantly is the child in need side, and our early help offer working alongside social services to step down children who are vulnerable. So again, on the right hand side, it shows that there were 2,402 offers of early help that are working alongside a family that had one or more member that was child in need. And then it shows that 2,004 families had stepped away from child in need status. 285 had remained the same. But I think the reason I like this table is it's honest, and it shows actually there were 86 families that were stepped up to child protection and 27 families that were LAC. But I think overall what this table shows you when you look at the data a little bit and you can look at the red boxes and the green boxes is that an offer of early help can have a significant impact on our citywide priorities in reducing the need for high-cost children's services, but more importantly, the outcomes that are needed for those children and young people, I think, to step away from safeguarding. Okay, if we could go on to the next slide, please. This just kind of gives you a bit of an overview about unauthorised absence and persistent absence and fixed-term exclusions. Again, I think some of the impact there is really, really important, and I think our school offer of early help and the breadth of the school offer in the city should be recognised here. And around a third of our early help assessments are done by schools. So I think it really is a big positive that schools are contributing to the offer of early help, but actually the impact for schools is very obvious here. And I just want to go on to the next slide, and this is the one that I'll just focus on so members have a good opportunity to see the impact on attendance. What we're focusing on here is persistent absence. I think because this is the one where schools are most worried. This is the ones where schools have 90% or less. You can see, so this is a 4-year period really, so it's quite good because it's a long-term graph. And the dotted line is the start of the intervention, and then onto the left-hand side is pre-intervention, and then on the right-hand side is post-intervention. So you can see attendance kind of falls quite rapidly before the intervention begins and continues to improve after that intervention is completed. So after 12 months, 36 months, so on and so forth. There's a few bumps in the road, as you can see, but generally attendance improves, but more importantly, continues to improve after that intervention has begun. If we go on to the next slide, please. Just some more detail here around crime and disorder and probably some information for our police colleagues, particularly around police call-outs, DV, ASB. So again, the impact an offer of early help can have is obviously pretty significant there. I'm not going to dwell on that one too much, and I'm sure people have had a chance to look at that. So I think the next slide, which I think is possibly the last one actually, if I remember rightly. Oh yeah, that's just a graph, just similar to the attendance one. If we go on to the next slide, please. Okay. Just a couple of conclusions, really, just before we take some questions. I think the first thing is I just want to say a big thank you because, as I said at the very beginning, this is not just the local authorities' evaluation, this is an evaluation of the partnership. So I want to thank all of the practitioners that have contributed to this. Anybody that has done an early help assessment has contributed to this evaluation. So all of those partners we had health visitors on before. Big thank you to Early Years Outreach and Health Visiting as well, who've made a significant contribution to this. I think when we look at an offer of early help can make a significant contribution to the need for high cost statutory children's services. I think the evidence is there to show that. We always struggle in early help to demonstrate prevention. I think it's always the really hard bit, how do we demonstrate that we've stopped something happening? It's always very difficult in early help. But I think that table, what we've tried to demonstrate as much as possible is that 97% of families who might otherwise have, as professionals that we know, who might otherwise have stepped up into children's services, 97% of those families avoided that high cost children's services, which I think is really, really important to recognise there. And again, a child in need status, 83% of those families that had an offer of early help working alongside social care, 83% of those were de-escalated within 12 months, which I think is really important again. The final point I just want to make before we take some questions really is just that the offer of early help can support, it's not just about children's services, it's not just about early help, it's actually about all of the city strategies and priorities and some of the wider strategic aims around our Manchester strategy, Children and People's Plan, inclusion strategy. I think we look at how an offer of early help will contribute to all of those things and make a significant contribution as well. So I think that's it from me. I've rattled through loads of data there. So I don't know if Julie, you've got any final comments?
No, thank you, Ed. We'll just take questions now. Thank you.
Well, thanks very much, Ed and Julie. I thought this was really interesting, actually, and I think it shows some really, really good progress, really, and particularly, the number of children that have been kept out of care and things like that. But that's me rabbiting now, isn't it? Right, so I've only got Councillor Reid at the moment. So if anybody else wants to ask a question, if you could indicate.
So what I said before, basically, Julie, the connection between obviously early help and early years was what I was talking about before, but the significance of what early help does is amazing and continues to do more and more. I just think that over the pandemic, there's a few questions I want to ask. First of all, about early help hubs. Some of those are schools, and obviously we're still open for key workers, children and vulnerable children during the first lockdown, but I just wondered if that had an impact on your work when everybody wasn't fully available and people were locked down because a lot of the staff were working from home. So that's the first question. The second question is about the connection, which I think is between early help and troubled families. Not all people who need early help are a troubled family, and I've always had this issue since Louise Casey started the troubled families work. About what a troubled family is, and I'm not trying to dodge the bullet that there are families who need a lot of help, but I just think that the link between early help and troubled families is not necessarily a troubled family isn't always needing early help, and early help isn't always a troubled family. So I just wanted to make that connection really. The other thing I wanted to mention was about what's coming down the road, which is I was talking to One Manchester about yesterday. Because there was a stop of evictions during COVID, and there still is with the second lockdown, there's an awful lot of people who've got a huge amount of rent arrears, and these are going to come to fruition when all of this is over, and they will end up with a lot of evictions. I mean, obviously we'll try and help where we can as councillors, but I am concerned about the amount of families that will be in that position, and I wondered whether you were preparing for that. And for the amount of families that, I mean, there's a lot of shops going, and we've heard about these shops like Arcadia Group, Debenhams, 13,000 workers who are low paid anyway, who are going to be out of work, and what that means as well for people and worklessness. So that's that question. Another one's about the statistics. When I'm looking at across the different areas, apart from Central, which seems to have quite a good proportion across different ethnic backgrounds, the other areas seem to have very low working with people with BME, and I'm just wondering how we can improve that. You might have things to say about what you've done in that direction. And then the crime and disorder was quite interesting to see about the amount of offences and the connection with early help and how that had been reduced. So I was wondering how you'd made that correlation. And then about parenting classes and when Sure Start centres can fully open up again, whether parenting classes can start, because I think we've seen it from the government making cuts in that, and we've managed to keep our Sure Start centres open on the whole. What we can do to actually do more in the way of parenting classes, because I think a lot of what happens in early years is that people's lack of understanding of child development. And then there was something about mental health as well, about the increasing, we're hearing about lots of these stories, thankfully none of which are in Manchester, about people who've done some bizarre things, like the child that was dropped in the water and you know, other stuff strange that's up the top of a Tate building. That, you know, strange things of where parents have lost it, basically, which is very sad for everybody concerned. There was one other which has escaped me. So if it was about the food supply, that when local groups, the connection between early help and local groups. So I know we have a local group that provides food provision on a weekly basis. I know Ardwick and Longsight do, and I'm sure lots of other areas do. I just wonder what your connection was with them. We've got connections with schools, but we haven't necessarily got a connection between early help. It'd be really useful for us to know where people need help. We can take meals because we get some provided by a company, and we can take food so that we could act as a conduit for you. So there's a lot of questions there. Thank you.
Yep. Sorry, Councillor Wilson.
Thanks for this. That was a really useful presentation, and I'd to echo Councillor Reid's comments there about well, kind of how good a pioneering approach this was, because I remember when this I remember about 5 or 6 years ago, it felt very much like, well, we'll give this preventative approach a stab in the hopes that we can improve outcomes and stop expensive interventions down the line, and hopefully save money that way rather than making more drastic budget cuts in children's services. And it's good to see kind of these results all these years later. Just to comment, you said it was quite hard to demonstrate a preventative approach, and I totally, I sympathise with that, because obviously it's hard to know what would have happened to these families had interventions not taken place. But I just wondered if we could have some raw numbers put to it rather than percentages, because that's a lot easier to kind of communicate to perhaps colleagues who aren't so familiar with children's services. If you can say this many people, we estimate that this many people, this many children weren't putting interventions to place down the line. Or up the line, sorry.
Sorry, have you finished, James? Yeah, right. Councillor Lovesley.
Thanks, Chair. Yes, I just had a question again. Obviously, it is really good to see at least a demonstration here in a lot of ways of how this approach is working, and especially of the multi-party kind of partnership arrangements, ensuring that we've got a much greater depth, as it were, of support for families. But in terms of the figures you give on page 43 across the city, I'm not sure if we're given anywhere a sense of the total numbers. We've been given percentages. So I just wondered whether there is any significance in terms of the overall numbers that you're dealing with from one district to another. And in terms of the central area in particular, of course, that's, you know, covers a quite diverse range of wards, but it would seem to me that perhaps we're looking here at an under-reaching of some of our Black, Asian and ethnic minority communities. So I just wonder, you know, whether you have any sense of that, of us not still being able to engage as effectively with a range of families in our city.
Thanks, Jill. I've got Councillor Bridges. Do you want to come in now, Gary, or do you want to come in at the end? And apologies for not bringing you in on the last item.
No, it's fine. Probably best if they answer the questions and I'll come in then, so that they've got them in mind. Okay,
right. Jill and Ed, do you want to respond, please?
Sure. So if I pick up some of the broader questions, and Ed, you can pick up the questions about the interventions and the reach. So I'll start and then I'll hand over to Ed. So thank you for your comments. In terms of the early help hubs, Councillor Reid, you asked a question, obviously, in terms of the impact on staff. I think it's fair to say from March through to particularly June, that was probably the significant impact on staff in terms of people were adjusting, as we all were, to having to work at home. We did have a number of staff who had school-aged children. Not all early help staff's children were given a priority in terms of school, so many of our staff were balancing home educating as well as providing the support and services. What we always maintained and we were always able to do is we have rotas, and the way we managed the work and the work we continue to do is we've always had small numbers of staff, and we still have today in each of the offices, because we run a duty service. We're there to provide same day support if needed, then supported by a bigger number of staff at home. I think particularly in that first phase of lockdown, there were fewer families who were reporting coronavirus symptoms and the impact of that. We've seen that really differently in the last 2 months or so, where we've had more of our staff who've reported symptoms either within their own family or have been in contact with somebody. So it remains a constant issue that we're having to adapt to. But what we've always had throughout is really strong connectivity with our partners. So when schools, over the first phase of lockdown, we used the school clusters, we used the advice and guidance service. We had 3 really key priorities during that period: support vulnerable families, support families to make sure that they were accessing practical help and support around mental health and well-being, and also the vulnerable families. And we were able to do that through that combination of having staff at home, staff in the office, and the combination of frontline and also virtual means. I just want to pick up on the association with the Troubled Families programme. We entirely agree with your comments, Councillor Reid, and I think going forward, really, what we see is, you know, how we work in our city. We have an early help strategy, and early help is an approach, it's not a service, and our partnership is our delivery arrangements. And really this is a means of a funding stream. And going forward for 20 to 21, some of the revised priorities around the Troubled Families programme, it will no longer have that title. This will be about how do you provide early help and prevention, and what does that mean in connectivity across the social care system. And we've got a lot to demonstrate that in our city. Particularly concerned, as you said, about the pressure in terms of the hardship for families around rent arrears and the pressures. We're doing some particular work. Joe Dalton, who you know, is doing some work in Manchester and supporting some work in Greater Manchester about what we can do to prevent and alleviate homelessness. And obviously debt and rent evictions is a key area, so it's absolutely on our radar. We're also making sure that we are aware and making sure that families know about some of the entitlements that they can ask, that they can apply for. And also we have our within the early help hubs, we've got really good access to advice and support around benefits in debt. And the other area that is being flagged up, and we are looking and we're going to be training our staff on, is what we've also seen is increasing concerns around gambling during the coronavirus. So we are going to work collectively with Greater Manchester in looking at a harm reduction programme there. Ed will talk about the crime and disorder and some of the analysis. In terms of our parenting, support for parenting has been a demand right throughout the last 8 months, and it continues to be high demand. What I'd say is that we actually are providing at this current time socially distanced groups, parenting interventions. We've done online, and online works, but has, should we say, some limitations. So at the current time, we continue to offer one-to-one support. We have video interactive guidance for our babies. We've got small socially distanced parenting groups, which are in the Sure Start Children's Centres and other venues. We also provided a parenting support telephone helpline in response to need over from, and that was in the last 6 months. It continues to be an area of high demand. In terms of connectivity with food groups, and our Sure Start Children's Centres have often taken the lead here, because we have a number of food groups and food clubs that are based in and out of our children's centres. But because we're based in the 3 localities, each of the 3 hubs is well connected, but we would absolutely welcome an opportunity to pick up and extend those links. What we also have been providing to families, and particularly at the start of the pandemic, where there was a number of shortages, particularly around essentials for families, we were able to support families, and we continue to connect families into those local arrangements. In terms of I think I've covered pretty much everything there, just in terms of obviously demonstrating the importance of prevention. I think through our work, both in terms of our early years delivery model, our early help evaluation, we're able to demonstrate actually the importance of that invest to save, but more importantly, and I think the bit, we've talked a lot about data and outcomes, and the bit that I just wanted to share with you is what we know from our families. So we have our conversations and also our evaluation. So, you know, every month we do a detailed focus and look at least 15 of our families in terms of the quality of the offer and the experience that they've got. And that enables us to get direct feedback from families, both in terms of the difference it's making, but also what we learn. And so we've got that data and we've got the impact, but more importantly, also what we've got is the family's perspective. And obviously, what we've seen through the early help hubs is that the demand for a coordinated and targeted offer continues to be a really effective way in ensuring we provide the right help and the right time and the right support for families. I'll move on to Ed, and Ed, if you could just pick up some of the data questions, and then we'll come back and answer any further questions. Thank you.
I think the first one was from Councillor Reid around offences and police offences. If I understood your question, Councillor Reid, it's about how we calculate that, was that? Or was it about what we do in particular to reduce that number?
Yeah, how you demonstrate that connection between how you would reduce the offences? I'm just not quite sure how you're making that correlation. What it is that you've done that's prevented the offences? Yeah,
so we get direct data from the police, which is quite good, which we can match against addresses. So we know when there were offences 12 months prior, and then we know where there are offences against an address 12 months afterwards as well. In terms of ASB, which is the sort of biggest call out, you know, I think, is we do quite a lot of work with families around routines. We do quite a lot of work with families around, where sort of challenging your children, I guess, supporting your, it goes back to the parenting thing as well, supporting some of those parents around challenging your, particularly adolescents, where are you, what you're doing, setting routines, setting boundaries. I know our practitioners will go into houses, sort of do calls at 7 o'clock on a Friday, or used to do before the pandemic, but would go and knock on at 7 o'clock on a Friday, try to support that mum, support that dad to set boundaries, I think. And I know it sounds quite simple, but actually it's very, very effective, because sometimes a lot of those parents haven't got the experience of setting those boundaries previously. So I think that's a very effective way of, particularly around the ASB incidents, but there's a number of ways we can do that. That's probably one of the strongest, I would suggest. The question, I think, from Councillor Wilson on numbers, I think you're referring to the area ones. Was that right, Councillor Wilson, about sort of when it was broken down to north, south, central? I think that was right.
Just generally, I think in terms of demonstrating outcomes.
Yeah, thank you for that. I think on the areas one, I think you're right. We can put some numbers on that. In terms of where we're talking about prevention, and 97% of those children and families who didn't have a safeguarding status, I think the numbers are on the chart there. But I think you're right. What we can try to do is, I think there's a table on, I don't know what it is on your pages, but certainly underneath the bar graph, directly underneath that, it says impacts are sustainable. It's got all of the percentages now. What I'll do is I'll talk to our data team about getting some numbers in there as well, if that would.
If you could send anything like that, Ed, to Rachel McKeon, and then she can circulate that to members, that'd be good.
Yeah, okay. We can do that. And in terms of Councillor Lovesey's about underreach and ethnicity and things like that, I think probably we talk about this evaluation as having, it demonstrates quite a lot of success, but I think one of the challenges back to us as an offer of early help and to early help hubs is actually what are we doing in terms of breakdown of impact on ethnicity, gender and other areas. And it's not something we've done previously, and I think off the back of conversations with you, conversations with some other forums we've been to as well, I think that's a bit of a challenge back to us to start to look at that. It's not something we've done previously, and I think there's two bits to that really. It's the numbers of Black and ethnic minority families that are receiving support, but it's also the impact on those families. Is there a disproportionate impact on the impact of those families? So I think it's probably twofold. That question is: are we getting the right amount of families in? Are we supporting the right amount of families? Are we engaging with them correctly? Once that's happened, once they've received that offer of early help, what's the impact as well? We've got the broad city analysis, but we don't have it by, well, we can have it. We haven't analysed it by, but we have got the raw data which we can analyse.
Okay, thanks very much, Ed. Just got a quick question from Councillor Hewitson, then I'll take Councillor Bridges.
Hi, thank you. What it was is, right, if I explain it to you and then you can give me an answer. I was in touch with a family who was going through domestic violence, and she got herself into rent arrears. The children were struggling in school, and what got me was that her housing provider knew what was going on, but never passed her case over to get help. And I'm wondering, do you actually get in contact with different housing providers to find out if there are families in the different wards, different areas that are struggling with domestic violence or children are skipping school? That was just my question.
Julie, do you want to shall I answer it,
Yes.
Julie?
Yeah, shall I come in and you can add? So it's a very good question. Our housing providers have always been a really key partner for us as part of the offer of early help. So they sit on our strategic boards, and we've always worked. We have good connections with our registered providers. We always have. What we've seen more recently, Councillor Hewitson, is actually our families who are in the private rented sector, where we see a lot of the issues are, and that's where we perhaps need some stronger connections. We'll always contact, and some councillors here are fully aware that housing and housing related issues are often one of the key reasons why a family comes into the early help hub, and we're asked to provide help and support. So we work really closely with our registered providers. We would contact and we would find that out, but you've highlighted an area I think that we perhaps need to go away, and we'll certainly take that to our next partnership board in terms of looking at what more we can do across the partnership in relation to that. But as I say, the work around evictions and homelessness is having increased priority in the next sort of development of our early help strategy and approach, and we'll be able to certainly demonstrate what we're doing in response to those key areas.
Okay, thank you. Councillor Bridges.
Thank you, Chair. And I think the only points I really wanted to make were in relation to both this and actually the previous item, which I think really demonstrate how important early intervention, our early help service, our early years service, and that multi-agency connection that Julie spoke about, just how important that is. Obviously, we referred earlier to the budget and the budget considerations we have every year because of cuts. And I think what's been really good in Manchester is that we have really retained that early help approach. And I think the information here and the evidence of that impact proves that it's been a good decision to do that. I think a couple of members have asked about could we look at how we can more clearly articulate how much that has potentially saved in not requiring longer term, higher cost interventions, and perhaps that's something we need to look at again as well as we go forward and build that into the evaluation, because I think in the presentation you do see how many families have been stepped down or who have not required a high level intervention, and maybe we could have a think about whether we can try and put some financial potential savings that could have led to as a consequence, to demonstrate how much not only has it meant to families but actually has been the right approach from a budgetary point of view as well. And I think over the last few years we've made some tough budget decisions as a council, but we have actually invested in children's services and invested and kept our investment in early help, and I think that has been right to do that. This week, yesterday, I attended a roundtable with some MPs and some national charities who were calling on the government to start to fund early help and early intervention in a more long-term sustainable way, because obviously we've had 1 year settlements and 1 year budgets for so long now, and we've had constant decade of austerity and then COVID. These are the sort of they're sort of described as non-statutory interventions. So from a children's services point of view, they're one of the only places you can look to try and make savings or efficiencies, but actually their dependence and their relationship with the statutory service, with the social work service, means that to remove some of these interventions is not only terrible and immoral for families, but actually then causes you further problems as a service later down the line when you've got more pressure on your social work service. So I think it is really important, and one of the things that came out really strongly in the discussion that I had yesterday was that these are the areas of the country that already had the highest levels of deprivation, the highest need in their services for families, has been hit hardest by COVID. So we talked about, we talked about attainment gap, we talked about families increasing in poverty, and it's areas like ours that have been hit hardest by COVID in that. So already, I was talking to Amanda and Julie Price the other day, and we've had a 5% increase in our free school meal rate, just because of the last 4 to 6 weeks, people losing their jobs, coming off furlough, being made redundant, in housing crisis. And so that there is likely to be a really big impact in Manchester. And looking at budgets and looking to having to take money out of vital services, we shouldn't even be in that position. The government said at the start of the crisis, spend what you need and we'll pick up the bill. And now all of a sudden those promises have kind of gone missing, really. And so, we're getting closed doors and being told to make savings and make cuts. So I just think both this presentation and the last one really demonstrate how important early intervention is, and we need to make that case very, very strongly, both locally and nationally. And then obviously family poverty's come up quite a lot today, and I just wanted to let committee know that Amanda Corcoran and Julie Price from Revenues and Benefits are working really, really hard on the free school meal scheme for December after we've got the funding. That's really tight deadline, but it's being worked on. And I know that the early years are a key part of that as well. It won't just be for school-aged children, because as we saw in the last presentation, there's a lot of families and new families with babies that are really struggling at the minute, and they're a key part, and they will get an offer as part of that as well.
Thanks a lot, Gary. Right, I'll sum up. I mean, thanks very much, Julie and Ed, for the presentation, which is really interesting, and I think it again shows what really good work is going on in Manchester, and I think the early help offer has been a success, and I think it will continue to be a success into the future. I've always been concerned about using the terminology troubled families, which I think is something that the government imposed on us. It's not about troubled families, it's about helping people, signposting them and giving them the best stuff that we can. Councillor Reid asked about where councillors might help in certain areas. If you could look at that and perhaps do a note to us, I think that would be useful. And like I say, I'd like. Is this the first time you've been to the committee yet?
No, I think I did one. I think I did council once, actually. I think we brought the evaluations full council.
Oh, that's right. Yeah. Sorry. Should have welcomed you at the beginning, but so.
Thank you very much.
Okay, all right. And thanks very much for the presentation and the questions, everybody. If we can move on then to the, sorry, I've just thrown it away. The proxy indicators, which I think we're going to get through pretty rapidly and then move on to questions. So, Sean.
Thank you, Councillor Stone. If I could just have the first slide up, which is the graphic in relation to the performance. The next one, please. For the sake of brevity, I'm very mindful of time, and we've had another very interesting committee as well as an additional report to receive. I'm just going to keep to this one slide. I'm joined in this presentation with Isabel Buller, who will speak to the bottom half of the slides that mainly relate to education services. Firstly, to say it's really timely that we have this report. We had a conversation in the last committee around about the quality of work that we're doing in children's services. And of course, this presentation is much more on our performance in relation to this. I always prefix this presentation with the data here as a pathway for discussion rather than an external and an internal focus on the numbers themselves. But if I can quickly kind of work my way through the presentation. Firstly, as you can see, that there's a number of red slides on there. Some of them are impacted by one of three things. The way that we are collecting data has changed for a couple of the indicators, namely the early help assessment and the number of children with a permanent plan after the second. Secondly, COVID has impacted on some of the performance, particularly around about child protection visits and timescale. And some of the performance figures have been a stretch target that we would not necessarily have seen gone amber or green because they are codependent on a number of other performance and service related reforms. So if I can quickly talk you through the issue here. We've spent a long time talking about early help this morning. The importance of the early help offer is central to our engagement with families from a statutory perspective, and we have had a significant conversation around about the importance of prevention and intervention. We have to say that their position around how we're collecting data in early help has changed, and we will be able to report on this figure in a clearer way as we implement something called EYES, which is a complementary system to our liquid logic system that will give us a clarity on the number of early help assessments. I do, however, wonder, and it's worthy of some discussion, as to whether we looked for some variation in this indicator, because as Julie in the last presentation that had said, it's a response, and therefore the focus singular on early help assessments may not necessarily be the most appropriate rate. We have talked again around about the importance of early years, and there's a strong performance over a number of years in terms of the early years settings that are just as good or outstanding. Importantly, our rates of referral into social care has reduced quite substantially. This was due to a reform of our front door service, and indeed, if my memory serves me right, the committee has also had a presentation on our advice, guidance and support hubs, which have dramatically reduced the requests into service for social care. Indeed, this approach has probably had an impact on children in need and the rates of children receiving a child protection plan. What we have done is, as we have attempted to do, is to recalibrate the system, arguably as a service that was judged as inadequate and requires improvement. We've recalibrated who needs what type of service and support, as we have strengthened our partnership and we've strengthened our evidential base for interventions. Our performance in relation to children starting child protection planning for a second or subsequent time is something that we do need to continue to focus on, as is the performance in relation to children ceasing being subject to child protection planning. I would say to you, and it's the data, the numbers are actually in the pack. I think that they are 10 and 9 children within those two cohort groups. So the number is really very small in relation to those performance aspects. I said that at least some of the impact of COVID has resulted in poorer performances than what we would expect, and that is attributed to the child protection visits and timescale, which is standing at approximately 91%. If we take a 3-year average, we're nearer 96% of those child protection visits in timescale taking place within timescale, which would of course take us to amber in relation to this as an indicator. I would say to members that for every single child who's not visited within that particular timescale, data performance system highlights those children, and there's a conversation had with the practitioner around the reasons why that visit has not taken place within the particular timescale, and any kind of remedial action is subsequently taken. We've seen a reduction in the number of children looked after, which is a positive reduction. We believe that there are probably twofold reasons for that. A better, improving, more evidentially based edge of care offer, coupled with an approach around about permanence, which is kind of easing children out of the system to an appropriate destination. We've noted a change in the way that we've calculated the figure around about permanence and the percentage of lack of permanence for the second review. That is a clear area of focus for us, and again this committee has heard around about our ambitions for permanence, but clearly the formality of ensuring that early permanence in terms of children who are subject to be looked after requires ongoing attention. Lastly, in relation to my presentation, we'll just pick on the numbers for average caseloads for newly qualified social workers and social workers. We've seen an increase as COVID has begun to impact on our services, and schools have reopened. As I said last month, that increase has been manageable as it stands. We've seen a slight increase in the average caseloads for social workers, and an opposite, a decrease in the average caseload for ASYEs. That is in part due to a higher number of ASYEs coming into the service. And at first glance looks slightly contradictory. I'll stop there. I've rattled through these as quickly as we can and be available for questions. But I'll also hand over to Isabel Dora, who will pick up the education in schools data.
Right, Isabel, you want to rattle through yours quickly, please?
Yes, thank you. I'll try and absolutely rattle. I just would just like to highlight that when comparing this proxy indicator report with previous, I think it's really important to know that we're not comparing like with like, particularly with attendance, because the way that attendance has been calculated has actually been changed. So, but I think that on those attendance figures, which equates as 94% attendance overall in that first half term, that is far better than anything we could possibly have anticipated, and also shows the impact of early help colleagues, social care colleagues, and the whole system supporting that. But I think, and I apologise that I'll try and be really brief, but there is a bit of a technical explanation here, because those numbers does not actually show the pupil experience, because the DFE have introduced new coding around COVID-19, and that's the introduction of the X code. Now, why that's important is the X code is not a present code, it's not an absent code, but it is given if a pupil is self-isolating, or if a bubble is sent home, or a year group is sent home. As soon as it's a positive COVID test, then that becomes I for ill. But that X code in the registers, you can't see it in those figures, because the DFE have said to remove it. So it's just removed out. But it does, it is important to just highlight it when our pupils are going into the same exam system as others. So that although we have that amazing attendance of 94% overall, that actually equates to 84% present in school. So high schools have been the most affected, and that's 15% of all codes used in secondary are an X code. So, which gives more of an accurate view of the actual pupil experience, but in no way takes away from the huge multi-agency effort that's taken to get these attendance figures that look to be really favourable when compared with DM colleagues. So that's, I just felt that we couldn't present this report without showing that. We've got a slight reduction in the proportion of good or better secondary school. That actually equates to one high school that went into serious weaknesses from previously being good. We have had another high school, also an academy, that went into special measures. And I think members know that inspections were halted in March. Since then, we've had HMI have done schools of assurance visits to RI and inadequate schools, and they've been quite positive, but do not result in a judgment. I think the other, sorry, I've tried to be really brief. I think the other aspect that just needs to be highlighted is, although that looks really, really positive exclusions data, and it is, however, we have seen in November an increase in our exclusion, and this is actually what the education psychologists predicted. They said that when pupils initially went back, that actually there would be to use a better phrase, for want of a better phrase, a honeymoon period where please be back in school. Those COVID measures seem to be supportive. However, we're now beginning to see that some of those secondary pupils have been in one classroom for 2-3 months, and we're beginning to see more exclusions for assistant disruptive behaviour. So I've tried to keep it very brief, but just wanted to highlight the use of the X code, so Councillor Stone now will take questions.
Oh, thanks very much for that. I think I thought the explanation of the X code was really interesting. So, I'm going to say massaging figures, but that's probably not the right way of putting it, is it? Anyway, Councillor Reid at the moment. Anybody else?
Thank you, Councillor Stone. Yeah, I've got a few questions regards the X thing. We've got a few others in colleges where we have one for remote learning. So if they're not in a classroom, they have a different code. So it acts as a neutral. And so it should with the pandemic. I wouldn't call it massaging figures when people are obviously ill, but they're still getting involved in learning. I have to say the amount of work that's gone into, I've seen my daughter is isolated for the last week, and she was desperate to get back into class, I've got to say. So there's, the bubbles pop and then they go back up again, and it's been absolutely amazing to think that the government has said that public sector pay is being frozen at a time when people have worked harder than ever is incredible, really. But then let's just leave that there, part there. A few questions with regards to school. It does say that 9 schools were partially closed. I would have thought it was more with the amount of bubbles that have been popping and back up again. But then it said 1 was still fully closed. So I don't know if that was at one moment in time, because I would have expected that if it was fully closed. I think the primary school my grandsons went to closed very early, a couple of days before half term, and then it was back in again. And then there's been 1 year gone down, etc., etc. So I think that's going to be a moving picture, isn't it, every week. So that was that. The other one I was concerned about in schools was regards to special schools. It said that the absence had gone from up to 16%, which I thought was quite high. And I wondered why that was, although I can probably guess. And then it was some of these reds at the top for Sean, really. If I go back to the, I can move my cursor, to the red blobs at the top where there are issues. There's a few questions as regards to those, and those are particularly, I've written down, of lack permanence plans in secondary. I've got a permanence plan in second review, i.e., in other words, 50%, nearly 50% hadn't. So I wondered if Sean has got any comments on that. whether that got something to do with COVID. And then there was a mention of 69 children missing education, which is a very high number, percentage presumably. If I can have a comment on that. And then there was one about missing from home, which said it hadn't got a target. It says there's a missing from home figure, 2,383, missing from home with no target. So I just wonder why there isn't a target. And then the social work caseloads. I mean, even though they're increasing, that's amazing compared to what they were years ago. That you can't complain about that. I remember back to Gladys, when Gladys was here, and we had some outliers who had a 50 odd in the case. So I think actually this is still good. It might look red, but to me it's not red. I think it's an amazing figure. Then there's another one about 431 children in need per 10,000 population. I assume that's when people see children in need, that's not children who have needs. It's children who are classed as part of that particular figure. So I just think that might be a little bit misleading. And that's probably enough for now. Thank you.
Okay, thank you. Anybody else want to ask any questions? I've not got any indication. Right, Councillor Bridges, you want to say something?
Thanks. Yeah, just on that last point that Councillor Reid finished on, I agree, and we've had this conversation quite a lot with the PRI about what classes as red and what classes as amber, and can we get that looked at? Because to me, some of those things on caseload actually aren't red, because actually, whilst they're more than 10% above what they should be, given the numbers we're talking about, they are a lot closer to our desired casework. And when you're talking in whole numbers, that can be a bit misleading. And as she said, that compared to how they have been historically, that is a very good picture. The one thing I was just going to say before that, obviously there's time, there's loads of other things we could say, but Isabel made the point about attendance, and about 84% attendance at current, any one period in time when you take away the self-isolating, and about that impact on assessments. And I just wanted to let committee know, councillors are already aware, but that I wrote to the Secretary of State to say that I don't believe that assessments, national examination-based assessments, can take place next year, and that they should have scrapped those in favour of teacher assessments, informed by classroom-based examination if necessary. Because what we're looking at the moment, and I think if we don't wake up to this now, is the outcome gap in Manchester is going to be eye-watering next year, potentially. The gap between Manchester and other places in the country, and the gap between the most able and the least able within our city, could be pretty shocking next year. And I've had conversations with quite a lot of head teachers already, and they talk about the very random nature. They will have a pupil in year 11 that's not missed a day, and a pupil in year 11 that has missed 3 consecutive periods of 2-week isolation. I don't see how you can come up with an examination system that allows those to take place on an equal footing. And if we think about the rates of infection in Manchester compared to the rates of infection in, say, a tier 1 location like Cornwall or the Isle of Wight, where they are in school constantly, they will probably have had a much better home learning experience throughout last year's lockdown as well. And bear in mind, most of these GCSEs and A-levels are 2-year courses as well. So actually this year's have missed more than last year's, when we thought we couldn't assess them fairly. So I just wanted to let committee know I have circulated that letter to councillors, but I know there are non-councillors on here as well. And that's my very strongly held view, and one that I have relayed to the Secretary of State.
Got a reply, Gary?
No. No, a reply in kind, in the sense that they are still talking very openly about their commitments to examinations, and they're going to go ahead delayed by 3 weeks, and that then sort of tough basically. But no, I'm waiting a reply.
Well, best of luck, because whenever I wrote to the Secretary of State, I never got a reply. Councillor Lovesley.
Thanks. Yes, 2 of the questions I was going to raise were the ones about assessment and the importance of us lobbying on that, because of the extent to which our children are losing time in school and missing in education. There was also just a question about the children with protection plans and coming back for a second child protection plan, and perhaps just have a little bit more detail on that, because although it's going down, it's not going down quite as much as we'd like, and you know, whether any of this is to do with the impact of lockdown and so on the way we're providing services. So just a quick question on that, please. Thanks.
Thanks, Jill. Right, Sean and Isabel, do you want to respond, please?
Yeah, shall I go first? So there's quite a number of questions I'll try and cover off. But maybe just should have said in the introduction, all of these data figures, with the exception of number missing from home, have comparative data and are nationally collated statistical basis. So really, in terms of just picking up the question around about numbers missing from home and no target, well, firstly, we don't have a comparative basis, so the impact of collecting that and making a target is limited because we don't have a comparator with other local authorities, and that we are not compelled in any way at all to report on the number of missing individuals. So there's more of a technical reason. I understand the question as to why we don't have a target, but there's more of a technical reason as to why we don't have a target in that particular position in relation to it. If we can pick also the lack permanence in review, I said two things in relation to why some of the reds were red. This particular one has got two reasons as to why it might be red. So the way that we've changed our data as we've moved from MyCare to Liquid Logic enables a much more forensic pool of the data. And what we've discovered in relation to this is that our Liquid Logic reporting mechanism was much more forensic. So that's driven the figure down. It was also part of a stretch target that we would have 75% of those children having a plan by the second review. So we wouldn't necessarily have expected to get to that, to get to green in that by at some point into next year, probably the later point of next year. Nevertheless, it's clearly an area that requires significant focus. Pick up the rate of children in need is very much the technical legislative term for children in need, not the number of children with needs in relation to that. So helpful question, and hopefully that's an opportunity for clarification. And just to pick up the second question, Councillor Munsey's questions. Again, there's a bit of a technical answer for this. As we have become, which is the children starting a child protection plan for a second or subsequent time, in part there's a mathematical answer to this question. As we have become more proportionate in the number of children who require child protection planning, we have reduced the overall number, and consequently your chances of being involved in that smaller number and then going on to repeat have also increased. So part of it is a contrasting figure that we've got here, but clearly in relation to starting for a second time shows probably two things. It shows sometimes the complexity of circumstances that people are in that require that type of intervention, and the other part of it is, of course, differing qualities of plans of intervention that affect and sustain change. I think that was all of the questions that were relating to children's social care, and I'd invite Isabel just to pick up the one or two that relate to education.
Thanks, Sean. Yes, I'll start with Councillor Reid's questions, if that's okay. And I think the first was just a reference to the use of the Xcode, and just to confirm that there is remote learning for those pupils who are affected by the Xcode, and we've already reported to the committee how we have shared good practice amongst our schools through webinars, and we're at the moment through our quality assurance mechanism, we're starting to gather actually an assurance about what that remote learning offer looks like. I think also, yes, that very much those figures for one school fully closed was at one moment in time. And I think, as Councillor Bridges alluded to, our schools continue to be affected by the infection rates in Manchester. So to put some context in that, last week we had nearly 4,000 children having to self-isolate, and that was across 82 provisions, and that was also 319 staff members. So that's the context that our schools are still working in. And to Councillor Reid's question about special schools, yes, even prior to COVID-19, we absolutely were, as reducing absence had been a real success story within Manchester, it was still those pupils with EHC plans and our special schools where we were targeting a lot of our support. Really pleased to say, though it's not within the presentation, that actually there has been an improvement in our attendance at our PRUs, our alternative provisions. There's been a significant uplift in attendance there, so that's been really pleasing to see. Some of that increase in proportion of absence in special schools is partly due to supportive timetables where parents and young people have had anxiety about COVID and have been on a kind of part-time timetables with some remote learning offers, some offer within schools. And sorry to be technical again, that goes down as a C, authorised absence. That partly, and also I think there has been understandably more anxiety amongst our special schools. I think, Councillor Reid, your next question was on children missing in education without an offer. So any child who is not on a school roll is classed as a child missing in education without an offer. And just to assure members that all those children are going through our processes, be that in-year fair access panels, and be that the statutory assessment team process. So all of those children are now being progressed through an offer. I think that Councillor Lovesey, I think you made reference also to the children missing in education, and also referred to the assessment issue of the and yes, as Councillor Bridges said, that there is clearly it's really important whenever we present the data of the 94% attendance, which is a huge achievement actually for the local area and needs to be celebrated. It needs to be done hand in hand with the pupil experience, which is 84% present in school. And I know that Amanda is on the call, and I think that she'll probably want to pick up anything.
Hi, I just wanted to quickly add on the children missing education. As Isabel said, those are all children that are in the process of getting an offer, and we always have a number in Manchester at any time. So there's always children arriving in the city, applying for a school place. And that's what those children are. Some of them will be going through in-year fair access. Some of them we will be looking at vacancies every week and trying to match them to the best offer. And we will do that for a period of up to a maximum of 4 weeks before we make an offer, but we will keep trying to get a better offer at the nearest school. And also some of those, as Isabel said, if they've got an education, health and care plan, there is an actual process that we need to go to. We have to consult with schools before children are placed there, and there's kind of timescales around that while you're consulting. But at one time in the city, you've always got children going through that process.
Thanks, Amanda, and thanks, Isabel. Thanks very much for the presentation, which I thought was really useful, actually. Some really good stuff in there. And obviously, the things we'll return to at the next few meetings. But can I thank everybody for that and everybody for the contribution. We'll move on to item 8, which is the holidays provision evaluation. I think we'll welcome in Councillor Rahman and Neil Fairlam, who's going to give a brief introduction. And thank you for sitting there listening to us. Sorry, he was introducing this.
All right, okay. I thought Neil, okay. Thank you, Chair. And I think we all recognise that this has been an extraordinary time for all of us, but particularly for children and young people and the challenges that they've faced during the first lockdown and subsequent restrictions that the pandemic has brought onto young people. During the summer, I think it was absolutely critical that we all got together and provided an offer for young people. And what we did at very short notice was bring together and mobilise all the different stakeholders and partners, so neighbourhood services, children's services, health, together to produce a holiday offer that has, of course, as you would see from the report that's been presented to Scrutiny this afternoon, the results that we've been able to deliver. That is an example of how we can, when we work together, deliver a programme for the benefit of our young people in the city. And I just want to, Lisa and Neil will talk to you more about the detail, but I just want to pay tribute to all the officers, particularly to Lisa, for coming together at very short notice and pulling together all the different partners and stakeholders, mobilising all our assets and making sure that young people are supported during this very difficult time. Lisa and Neil, do you want to come in?
Thank you, Councillor Rahman. There's not a huge amount to add, really, and I'm conscious of time, so I won't take up too much time. But just to say, I think it's fair to say where we were in the summer was, with 4 weeks to go before the summer holidays, we were facing a significant challenge in that if we had not intervened as a council, and many local authorities didn't intervene, by the way, then we would have had a much reduced offer over the summer holiday period. So we pulled together with agencies, with youth organisations, but also working closely with children's services to make sure, with really a 4-week lead-in period, that we had a meaningful offer for our residents. Essentially, we focused in on 4 key objectives. One was to prepare young people for education, recognising that at that point in the summer holidays, young people had been out of school for at least 3 months. We also were focused on trying to make sure we were given the right support in terms of physical and mental well-being, in terms of building emotional well-being and resilience as well, but importantly also to give opportunities for young people to just participate in something positive and hopefully divert them from doing negative activities over the summer holidays. And that was also important, I think, for parents who needed a degree of respite after 3 months of homeschooling and various other things that had gone on in the build-up to the summer holidays. So, as Councillor Rahman has said, the report doesn't just focus on summer, it also focuses on the half-term period in October. It's been a huge success. We've had over 20,000 young people engaged in the activities, over 1,300 sessions delivered, great take-up in terms of the diversity of the users who've taken up the offer, and importantly it's created a platform for how we're going to work going forward with an extended offer over Christmas and also in February in 2021. And then finally, probably the last point just to point out is, every bit of provision that we have put on over the summer and in October, and we will continue to put on going forward, has got holiday hunger initiatives and activation built in to all the programmes that we're providing to ensure that young people don't go hungry during the holiday periods. And as Councillor Rahman has indicated, I'm joined by Lisa, who leads on all of our youth provision within the city. So happy to go straight to questions, and I suspect Lisa and I will pick up the response to most of them. Thank you.
Yeah, thanks, Neil, and thanks, Luke, for that, and welcome to Lisa. I think we've excuse me, I think you've been there before, haven't you, Lisa? Yeah. Blimey. Councillor Reid, and then I'll stop choking, hopefully.
Yeah, just a very quick comment about the hideout. It's not been open very long. Councillor Rahman and I were social distanced with Councillor Lees there when it opened. And it's just been a major success, as you can see from the comments. So it was a much needed provision within the area, and it's been obviously not as much used as it can be because of the lockdown. But once we get out of the lockdown, it's already proved its worth, and I'm sure it will. Budget, even with budgets, I'll fight tooth and nail to keep that place. It's obviously self-funded anyway. So, and Adam Farricker is doing a massive job. He's doing loads of stuff as well, outreach in the community already, working with age friendly, etc. So fantastic. Thank you.
Thank you very much. I think it was more of a comment than a question. Does anybody got any questions? Nobody's indicated. Councillor Lovesey.
Yes, thanks very much. I mean, it's a really welcome report, isn't it, to see how much we've been putting on for our young people, and it's so well focused and targeted. I just thought it would be useful for us as councillors if at some point we could get some kind of ward breakdown of uptake of these activities. Obviously, some of the key services are provided in larger hubs which cover several wards, and I think we're never quite clear how far those are reaching out into surrounding wards, and I don't know whether it's possible for you to provide that kind of data. It would be helpful. Thanks very much.
Okay, Miss Barnwell.
Thanks, Chair. I was just looking through the report. It only mentions STEM provision at Debdale Centre. I know there was quite a lot going over summer, and we did a lot of things with short breaks. But is there going to be anything over Christmas, the Christmas period, for SEND children? I think that might have a link into what the other presentation was referring to before, as the absence going up, for example. So I just wanted to know, in terms of that, in terms of how the children, the SEND children, are feeling, will there be anything in the pipeline for them over the Christmas holidays? Thank you.
Thanks, Samantha. Anybody else? No? Anybody? Sorry, do you want to reply to the questions then? Thank you.
Thanks, Chair. Do you want me to reply, Neil? Is that
yes, Lisa, you go.
So certainly for members, we can provide a ward breakdown, but just to say that every ward in the city was covered with provision on most days, with the exception of the city centre wards. But as you say, there are other provision that covered across city. In terms of SEND provision, what we ask our providers to do now is ensure that all provision is inclusive, and we worked really hard in the summer with the SEND team, with Maureen Howell, to ensure that providers understood how they needed to frame provision, how they could make it more accessible and inclusive. And as you've alluded to, we did put on a separate provision at Debdale. I'm working with Manchester Active and GLL now to understand what they can provide in that Christmas period. So we'll certainly be getting that offer out in the next couple of weeks, and I'll make sure that it comes to you so that you can see what is available.
Yeah, thanks, Lisa. I mean, I know that the SEND provision at the outdoor sailing centre is really good, because when I was a governor at Mellon School, they used it a lot, and I know other special schools use it as well, and it's really well received, and it's excellent. It's just sad that on my walks, one of my walks is around Debdale from home, is just to see it all locked up, and so it really is sad, but that's the sort of position we're in. Anybody else? Well, can I thank you all for the report, and thank you for everybody. Take it back, Lisa and Neil, to the staff, to say thank you for the work that they've done. It is really appreciated, and I know the young people in Manchester really do appreciate it. and we look forward to working in the future on these sort of schemes. So thank you very much, everybody, and thank you, Lutfer, for coming today. Okay, last item then is the Governance of Scrutiny Unit report. Anybody got any questions on that? As I mentioned earlier, for the next meeting, I think the emphasis will be on two things: the budget, which and obviously the COVID update. So if nobody's got any questions, can I thank everybody for coming today? Can I wish you all a happy Christmas and a happy New Year? Don't mix with too many people. Remember, you can only have 3 people into your house, so three bubbles. I think a number of us are a bit dubious about whether this is going to work or not. But anyway, try and enjoy yourselves as much as you can, and you know, and I look forward to seeing you all in the new year. Thank you very much, everybody. And can I ask everybody who's in the general meeting to stay on? Sean, Amanda, and who else? And ask the technical people to
Thanks, Bernard. See you later.
Thank you. See you all.
Thank you, Bernard. Thank you.
Thank you.
Bye.
Bye.